I'm actually optimistic that given the fact that the problems have now been recognized, that there's a pathway to making a very good organization much better.
Very good. Very crap. Fauci, Walensky, resign. Will this CDC overhaul actually change anything, or are these bozos still full of hot air? Joining me to discuss, Cato Institute senior fellow and practicing general surgeon. He knows something about free market medicine. Dr. Jeffrey Singer is back. Welcome back, Dr. Singer.
Hi, Kennedy. Great to be here.
So let's discuss this a little bit. I mean, obviously, the CDC, Walensky herself contradicted statements constantly. You know, she was like, oh, it's so dire. I have a feeling in the gut of my soul that something awful is going to happen. And then the next week, it's like, yeah, everyone can stop wearing masks. Bye. It's more than rot within a single agency. How have they screwed up in your eyes?
Well, first of all, I think, as we agree, the CDC is in desperate need of a makeover, and I got to commend Dr. Walensky for at least recognizing that. I have some suggestions that she hasn't come up with that I think are very important. First of all, I think that she needs to end the culture of groupthink that exists in that agency, and that starts at the top. You know, the biological sciences are not black and white like the other sciences. There's a lot of gray, and so you need to encourage a diversity of scientific opinions and welcome challenges to what you think you know. Otherwise, you never know when you're wrong, and that's why it takes so long sometimes for the CDC to recognize that they're completely off base in their recommendations. In addition to that, I think CDC has mission creep. I mean, when they were created over 70 years ago, their mission was to fight the spread of communicable infectious diseases. And they started with getting rid of malaria that was infecting the southern states, and then they focused on things like polio and measles and that kind of thing. But in recent years, their mission has spread out to things like fighting obesity, smoking, violence, telling doctors how to prescribe opioids to their pain patients. And while all these things may have some public health, they may have something to do with public health, that's way beyond their mission. And when you do a whole lot of things, you wind up not doing anything well. So I think they need to get back to their original mission of fighting infectious diseases. And then another thing I would have them do, this is a tougher one, they need to get themselves disassociated from the political branches of government. You know, in Scandinavia and a lot of Europe, the people there trust their public health agencies because their public health agencies are completely detached from the political groups. They act independently. And here in this country, particularly with our polarized political situation, every time the head of the CDC would appear, for example, in a presidential press conference, then people would look at it through a political lens. So we had, for example, during the Trump administration, Democrats saying, I'm not trusting that Trump vaccine.
Kamala
and
Harris
then when
said
Biden
that.
became president, right, and then when Biden became president, those same people were saying, if you don't take the vaccine, then you're the problem. So the best thing to do would be to have a policy where the CDC director and director of other health agencies is not kind of standing shoulder to shoulder with the president, but maybe sends a representative, because I think if they are viewed by the public as being sort of a detached, independent agency, then people will gain their trust in them.
Yes, it's been good to have Rand Paul pressing in on Dr. Fauci, but some of Dr. Fauci's responses feel so incredibly political, but also very, very narcissistic, as though he and Rochelle Walensky are the only two doctors in the country.
Right. There are a lot of different viewpoints. When you're dealing with the life sciences, there's a lot. I mean, we've all noticed this. We've learned this in the last few years, that you think you know something until about a few days later when you get more information, and now your understanding has completely turned around. You need to have humility. And the best way to show humility is to welcome a diversity of viewpoints, to actually encourage people to challenge your viewpoints, because that's how you learn.
Yes.
And so what's been happening over the past few years is anybody who doesn't basically accept the whatever
orthodoxy
is coming out from the CDC as an orthodoxy, right? As sort of like the word from Mount Sinai. And if you don't accept that, then you're a heretic, and you're to be derided.
And that's what Fauci did when he was presented with the lab leak theory early on. He squashed dissenting opinion, and those who switched their opinions, they ended up with multi-million-dollar grants. So good for them. Dr. Jeffrey Singer, thank you so much. Good to talk to you.
Thank you, Kennedy.
Thank you.